muscle tests are how we're going to assess our patient's strength. And at the knee, we really just look at knee flexion and knee extension. And we're gonna start with knee flexion first. And with these, remember that they do some internal external rotation, so you can ask them to internally and externally rotate their lower leg as you do these motions to try to isolate either the lateral or medial structures. For the purposes of this video, I'm just gonna do them in the central position or the neutral position to just demonstrate how we would typically do this. So the way that we start these off are 0 means that you would ask them to try to flex their knee or bend their knee, and you would not feel any kind of contraction whatsoever. A 1 is you would ask them to flex their knee and you wouldn't see any motion at the knee, but they would at least be able to contract, and you're either going to see the contraction of the muscle or feel it, or both. For 2, I explain these a little bit different than some other people. For a 2, technically, it needs to be not against gravity, and really they should be lying on their side for the 0, 1, and 2. For 2, another way that you can do it is ask them to try to flex their knee, and if they can get it a little bit off the table, I would probably grade that as a 2, because a 3 means they have to go all the way full range of motion against gravity. Or another way to do a 2 is that they are sidelined and then they're able, again, this is anti-gravity because they're not going up against gravity, they're able to fully flex their knee but on their side. And you can hold their leg as they do it. It could either be their top leg or their bottom leg. For a 3, you're gonna ask them to flex and they're able to come all the way up through the full motion, get to end, and then come back down, and it's nice and controlled. For a 4, when you do it, you need to make sure that you're stabilizing and you're going to resist at their distal leg, and you're going to be applying some resistance. They're able to go through the full motion and they're resisting on the way down, but you're not applying too much resistance. And then for a 5, they're coming up and you're applying moderate to significant resistance against them. They're able to hold it at the top and they can resist you on the way down without experiencing pain or weakness or being different from their right to their left side and vice versa.